On this episode, we'll talk about electrolytes and your sleeve. We'll also talk about constipation and how to avoid it. And we'll also talk about how often you should actually get on the scale. I'm Dr. Alvarez from Endobariatric.com and welcome to episode 47 of the AskDrA show. Thanks so much for tuning in and sharing the AskDrA show. It's just an honor to receive more and more questions from abroad, from other countries, from other continents, and it's just fabulous to be able to help out people, to help patients, to help you with minor questions, with doubts that you may have. So just to remind you, if you're new to the show, you can always submit questions using Instagram, YouTube, Facebook, and YouTube, of course. You can use the hashtag AskDrA, and my team will actually pick those questions out, grab them, and we can add them to the show. Also, now, if you haven't added me on Snapchat, you're welcome to do so. That way you can link your phone to my phone and send me the questions directly, all right? So the username of Snapchat is on your screen. You can always add me, all right? So let's get into the show.
Is my sleeve preventing me from absorbing electrolytes I use to keep me from being dehydrated?
Okay, so the question is electrolytes, and are they not absorbed correctly after the sleeve? Are they, do they get absorbed differently after the sleeve? The answer is no, okay? Electrolytes normally get absorbed in the intestine. Remember that the sleeve does not mess around with intestines. The intestines do not get rerouted, so the absorption of electrolytes is 100%. It does not vary, okay? So put your mind at ease. Electrolytes get absorbed 100%. They will not be malabsorbed or you won't have a deficiency of these because of the sleeve itself.
What can be done to prevent constipation as soon as surgery is done?
Okay, so constipation. How to avoid constipation. Number one, it's very important to know if you had constipation before surgery. If you had constipation before surgery, you're more likely to have it afterwards. Now, it's not common that if you didn't have constipation, you will develop it afterwards. So normally it is if you used to have it, you'll have it. If you didn't, you won't have it. Okay, so put your mind at ease. It has no direct relationship. Now, right after surgery, people who do have constipation may get constipated. How to avoid it? Patients normally take a soft stool softener. You can take Miralax, you can add a little bit of fiber, you can use Metamucil. You can contact your doctor directly. You can, of course, my patients have my direct email. You can email me and we can give you a few suggestions on how to avoid or treat the constipation. But the point I wanted to take home message here is don't forget to count your fluid intake. It's very important to stay hydrated. If you're not well hydrated, constipation will follow, all right? Even though you do a stool softener, even if you do fiber, you need the water intake, you need the fluid intake, so actually it can help you with the medication or the stool softener, okay?
How often should I weigh myself?
Okay, so how often should you get on the scale? Please don't get on the scale every single day, all right? It's just, let me tell you why. Some people get their surgery, right after they get the surgery, they're discharged, and before they're going home, they want to get on my scale again. And I tell them, please don't get on the scale. You'll be disappointed. I mean, you'll be just in shock because the scale will move up. Why is this? Because of all your IV fluids that were placed during surgery or while you're in the hospital. IV fluids will take a few days for the body volume to actually readjust, and you'll pee it out, and then you'll notice that the scale will start to drop. So these changes, and I'm talking about the change right after surgery, but there are also changes in your body when you're doing something different, like you went hiking one day and maybe your body got water retention, or your body got dehydrated, and these changes will climb on the scale or will decrease on the scale. Now, the best way is get on the scale every 7 to 10 days. Don't get on the scale sooner than 7 days. Now, people, I know this is super hard for you to do, but work at it. Best way to measure your progress is your clothes. All right, clothes don't lie. So your scale will move forward. It'll move down progressively, slowly. Please, please, just remember this is a long-term process. You're looking at 10, 12 months down the road. Don't think this is going to work like in a month and you're going to see 50 pounds down. No, 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 no. This is progressively, constantly, slowly over a period of time. Remember, during this period of time, you will have some stalls, and these stalls are normal. Please keep that in mind. They're normal. You don't need to freak out because you hit a stall. You don't need to call 911 because you hit a stall or a plateau. Remember that these stalls are needed for your body. Your body is readjusting, what I just mentioned a few minutes ago. I mean, your body needs to readjust, and these adjustments occur frequently, and but your body will continue advancing. All right, so patient people, don't get on the scale every single day. Wait at least 7 to 10 days. Maybe you have, I have some people that, some patients that will just weigh on my scale. That's fine. Every time they come, I don't get on any other scale. I just use yours, doctor, which is great. They see the progress with their clothes, how they start to feel different and everything. And they use one scale every 2 or 3 months once they come to visit us. So the take-home message is don't get obsessed by using the scale. All right, so that's it for episode 47 of the Ask Dr. A show. Thank you so much. Big announcement. We now have the Ask Dr. A book. All right, so now it's available on Amazon. Be sure to check it out. Amazon will be having the pre-order of the book. It's a special, and it's going to be until June the 6th. After June 6th, the price will increase, so you be sure to get yours. It's a whole bunch of questions, and it's terrific work, all compiled there into a book. It's a good reference, question and answer, just like the show. And the show was transported into a book now. All right, so I know you're going to like it a lot. So the book is out. Be sure to check it out on Amazon. The other thing is, question of the day. How often do you, be honest here, how often do you get on the scale? Answer down here on the comments section. I'm eager to read about you, all right? So I'm Dr. Alvarez from Endobariatric.com, where we are changing lives one sleeve at a time. Take care and God bless. Bye-bye.